What is the difference between stage and grade of a cancer? In this video, I'm going to be talking about what is stage, what is grade, and what impact do those have on our treatment decisions. Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content based on your comments and suggestions, so make sure to subscribe. If you're curious about what stage and grade your cancer is and what it means for you, go to Yerbba.com to get your personalized Yerbba report. Your Yerbba report is created by cross-referencing medical information from your records after you give us permission, cross-referencing that with the most recent medical evidence, and then creating for you a report personalized to your specific tumor characteristics and your other medical problems. Your report will show you all the options you might be offered with the pros and cons of each one. Again, that's Yerbba.com to get your personalized report. So let's start by talking about stage. This is a word that people are really familiar with. I'm going to talk about what stage means, how we figure it out, and what that means for your treatment, and then I'll move to grade. Stage refers to where the cancer is in your body and how much there is. So it refers to the size of the tumor in the breast, the status of the lymph nodes, those glands under the arm, and characteristics like, is it attached to the skin or the chest wall? What is it movable? And is it in other parts of your body? Stage 1 cancer, and I'm not going to go in great detail because we have videos on each stage, but just briefly, stage 1 means the tumor is confined to the breast, it's not in the lymph nodes, and it's actually a pretty small tumor. It's 2 centimeters or less, so smaller than a AA battery. Stage 2 means that the tumor is either over 2 centimeters or 1 to 3 lymph nodes is positive. So the tumor is a little bigger, or the nodes are positive, but only up to 3. Stage 3 means the tumor is bigger or more than 3 lymph nodes are positive. And stage 4 means that the cancer has spread to other parts of the body. And you can see that sounds really different, whether it's a small tumor in the breast all the way to spread to other areas of the body. We use stage to help us decide the types of treatment, not so much the surgery, but rather systemic treatment and radiation therapy, and also to help prognosticate what's to be expected if this cancer is left untreated. What's the risk of the cancer coming back? And stage 4 cancer is treated very differently from stages 1, 2, or 3 breast cancer. And we have other videos about that, so again, I'm not going to go into great detail. What I do want to do is move next to grade. Grade is very different from stage. What grade refers to is what the tumor looks like under the microscope. So no matter how much tumor is in their body, slides are made of the tumor and it's looked at under the microscope. So somebody could have a tiny tumor, less than a centimeter, or they could have disease throughout the whole body, and we're deciding what it looks like under the microscope. Grade is divided into grade 1, 2, or 3, and these are not Roman numerals. With stage, we use Roman numerals, and with grade, we use what are called Hindu Arabic numerals, 1, 2, and 3. Grade 1 tumors are tumors that look a lot like normal breast tissue. They're not quite normal cells. They're a little more disorganized, but they're not wildly disorganized. And I'm going to go to the opposite end. Grade 3 under the microscope has much more dividing, much more abnormalities in how the nucleus looks of the cells. They're just much less organized. And grade 2 is somewhere in between. There are different grading systems, but all of them get collapsed to either 1, 2, or 3. Grade, unlike stage, is incorporated in how we treat somebody's cancer, but it's not the same driving factor. Higher the grade, the more active the tumor is. I'm really careful with the word aggressive because people can come in through the door and be diagnosed with a grade 1 stage 4 cancer, which is very different from a tiny, tiny tumor that's a stage 1 with a grade 3 under the microscope. So the reason I'm careful with the term aggressive is because when we think aggressive, we think that means the likelihood of surviving or the likelihood of the cancer coming back. So what I tend to do is use the word active, because that's really, we're talking about the personality of the cells under the microscope. More active cells, grade 3 cells, tend to be more susceptible to chemotherapy. And so maybe it's helpful to think of them not as more aggressive, but more active. And more active meaning they're more susceptible to treatment. Grade 1 tumors, on the other hand, grade 1 tumors are really slow growing and tend to be more likely to be estrogen and progesterone receptor positive and HER2. Not all the time, but they tend to be. And so we can be a little less aggressive in our treatment than we are with tumors that are grade 3. But again, grade goes along with other characteristics that help us make a determination of what is that cancer's personality like. I do have to say, a pathologist, the kind of doctor who looks under the microscope, cannot actually tell you what stage you have. So if you've looked at your pathology report, they may say it's a T1CN1, meaning the tumor is close to 2 centimeters with 1 to 3 positive lymph nodes. And because they don't know is cancer elsewhere in your body, they haven't physically examined you or asked you if you're having symptoms, a pathologist can tell you about the tumor size and the lymph node status, but not completely determine your stage. Whereas the pathologist is the one who assigns the grade of the tumor. The stage is determined by a clinician who sees patients, the grade by a pathologist. If this isn't clear, drop a comment or a question. We respond to those as quickly as we can, usually within a week or two. Please be kind, we're only human. And if you want to learn more about your type of cancer and your treatment options, don't forget to go to Yerbba.com.